Hello, my name is Erin Riel, and I'm a member of the planning team here at CARES of New York. Today, I will provide a brief overview of the fiscal year 21 Continuum of Care Notice of Funding Opportunities, or NOFA. This webinar was developed specifically for COC membership, board members, and community stakeholders. CARES developed this webinar because we believe it is our responsibility as collaborative applicant to provide clear and concise information on the COC NOFO to the full community to ensure the COC process is community-centered and transparent. Today's presentation provides a summary of fiscal year 21 COC NOFO in a brief and succinct format. Specifically, the presentation will discuss HUD's policy and program priorities, 2021 funding opportunities and deadlines, the application process, and the application criteria. Because the NOFO details a variety of important topics, CARES has produced a series of webinars to cover specific topics in more detail. Our webinar series includes presentations on today's topic, NOFO summary, HUD priorities and the consolidated application, new project opportunities, DV bonus opportunities, opportunities for renewing projects, eSNAP refreshers, setting up a renewal, and setting up a new project. Please be sure to view these webinars in the NOFO section of the CARES website. Please also be sure to visit the NOFO page on the CARES website regularly for important application information and due dates. Before detailing HUD's policies and priorities, it's important to have a clear understanding of the Continuum of Care program and its goals. The Continuum of Care, or the COC program, is a funding stream out of HUD designed to promote a community-wide commitment to the goal of ending homelessness. The program provides funding to nonprofits, states, and local governments to quickly rehouse homeless households while minimizing trauma and dislocation caused by homelessness. The program is designed to promote access to and effective utilization of mainstream programs by homeless households in order to optimize self-sufficiency. On the local level, the COC is the body of stakeholders who work collaboratively to implement the COC program and to effectively and efficiently solve homelessness. New to the NOFO this year is the ability for tribes and tribally designated housing entities to apply as project applicants. These entities are eligible to apply as project applicants for new funding and can be listed as subrecipients for new or renewal project applications. COC project applications from other agencies can also apply for projects located within formula areas. However, as stated in section I.K of the NOFO, quote, applicants that propose to claim a reservation or trust land geographic area and to locate a project on a reservation or trust land must include a tribal resolution from the tribe authorizing the applicant to do so. Tribes do not need to include a tribal resolution to claim their own reservation or trust land or to site a project on their own reservation or trust land. A tribal resolution is the formal manner in which the tribal government expresses its legislative will in accordance with its organic documents. In the absence of such organic documents, a written expression adopted pursuant to the tribal practices will be acceptable, end quote. The tribal resolution must be attached to the COC application or COC priority listing using one of the open attachment fields. To better understand how HUD developed the COC NOFA criteria and application process, the NOFA documents 7 policy priorities as you can see on your screen. We will now walk through and describe each policy priority. The first policy priority is to end homelessness for all persons. COCs should work to end homelessness by identifying, engaging, and effectively serving all persons experiencing homelessness. Specifically, COCs should measure their performance based on local data that consider the challenges faced by all subpopulations experiencing homelessness in the geographic area, e.g., veterans, youth, families, or those experiencing chronic homelessness. COCs should partner with housing, healthcare, and support service providers to expand housing options such as permanent supportive housing, housing subsidies, and rapid rehousing. COCs should use local data to determine the characteristics of individuals and families with the highest needs and the longest experiences of homelessness in order to develop housing and support services tailored to those needs. HUD's next policy priority is to utilize a Housing First approach. Housing First prioritizes rapid replacement and stabilization in permanent housing and does not have a service participation requirement or precondition. COC program funded projects should help individuals and families move quickly into permanent housing. And the COC should measure and help projects reduce the length of time people experience homelessness. Additionally, COCs should engage landlords and property owners to identify an inventory of housing available for rapid rehousing and permanent supported housing participants, remove barriers to entry, and adopt client-centered service methods. HUD encourages COCs to assess how well Housing First approaches are implemented in their communities. The third policy priority is to reduce unsheltered homelessness. In recent years, the number of people experiencing unsheltered homelessness has risen significantly, including a rising number of encampments in many communities across the country. People living unsheltered have extremely high rates of physical and mental illness and substance abuse disorders. COCs should identify permanent housing options for people who are unsheltered. The fourth policy priority is to improve system performance. COCs should be using system performance measures such as average length of homeless episode, rates of return to homelessness, and rates of exit to permanent housing destination to determine how effectively they are serving people experiencing homelessness. Additionally, COCs should use their coordinated entry process to promote client choice, coordinate homeless assistance in mainstream housing, ensure people experiencing homelessness receive assistance quickly, and make homelessness assistance open, inclusive, and transparent. COCs should review all projects eligible for renewal in fiscal year 2021 to determine their effectiveness in serving people experiencing homelessness, including their cost effectiveness. COCs should also look for opportunities to implement continuous quality improvement and other processes for improvement strategies. HUD recognizes the effects of COVID-19 on COC performance and data quality, and compared to previous COC NOFOs, HUD has reduced the points available for rating a COC system performance. However, HUD plans to significantly increase the points available for systems performance in fiscal year 2022 and subsequent COC NOFOs. The fifth policy priority is partnering with housing, health, and service agencies. HUD encourages COCs to maximize the use of mainstream and other community-based resources when servicing persons experiencing homelessness. Using cost, performance, and outcome data, COCs should improve how all available resources are utilized to work closely with public and private healthcare organizations and assist program participants to obtain medical insurance to address healthcare needs. COCs should partner closely with public housing authorities and state and local housing organizations to utilize coordinated entry, develop housing units, and provide housing subsidies to people experiencing homelessness. COCs and public housing authorities should especially work together to implement targeted programs such as the emergency housing vouchers, HUD-VASH, mainstream vouchers, family unification program vouchers, and other housing voucher programs targeted to people experiencing homelessness. COCs should partner with local workforce development centers to improve employment opportunities. And lastly, COCs should work with tribal organizations to ensure that tribal members can access COC-funded assistance when a COC's geographic area borders a tribal area. The sixth policy priority is taking action to increase racial equity. In nearly every community, Black, Indigenous, and other people of color are substantially overrepresented in the homeless population. HUD is emphasizing system and program changes to address racial equity within COCs. COCs should review local policies, procedures, and processes to determine where and how to address racial disparities affecting individuals and families experiencing homelessness, including evaluating projects through rank and review on the demographics of persons served compared to the homeless population as a whole. And the final policy priority refers to including persons with lived experience in planning and funding decision making. HUD is encouraging COCs to include in the local planning process people who are currently experiencing homelessness or who have formerly experienced homelessness to participate in how the community addresses homelessness. People with lived experience should determine if local priorities need to be revised and updated. They should participate in COC meetings and committees as stakeholders. They should provide input on decisions and provide input on the local competition process. For example, they could review how rating factors are determined. COCs should seek out opportunities to hire people with lived experience. It's important to note that HUD is specifically looking for COCs to engage persons with lived experience within the last 7 years and/or persons who have experienced street homelessness or unsheltered homelessness. In fiscal year 2021, HUD has made $2.6 billion available through COC program funding application process, which is an increase from $2.3 billion last year. In order to access this funding, the NOFA lays out a variety of important deadlines. The full consolidated COC application is due to HUD on November 16, 2021. 3 additional HUD-required deadlines revolve around the local competition. Project applications must be submitted in eSNAPs 30 days prior to the application deadline. Project applicants must be notified of their inclusion or exclusion in the COC application at least 15 days prior to the application deadline. Finally, in order to have transparency with the full COC, all parts of the application must be made available at least 2 days prior to submission. CARES works hard with each community to establish more stringent deadlines in order to ensure a more transparent process and a better overall score. Please review your COC's timeline on the NOFA page of the CARES website and ensure if you are submitting a project application, you do so on or before the required timeline. Please note that there are local deadlines for both the rank and review process and the submission of project applications within eSNAPs. CARES is setting the deadline for renewal applications to September 10th and for new applications to October 8th. I would now like to take a couple of minutes to walk through the application process. The COC registration is the beginning of the application process and typically occurs towards the beginning of the calendar year. During the registration period, the collaborative applicant, CARES, indicates to HUD the COC's intention to apply for COC funding. CARES reviews prior year's information for the COC and submits any changes. This is also the time a COC can request to apply for Unified Funding Agency status, or UFA. The second part of the application process is submitting the COC Grant Inventory Worksheet, or GIW. The GIW is used annually to record all grants within a COC's geographic area that are eligible for renewal funding for an upcoming COC program competition. CARES works with COC-funded agencies to review and confirm their budgets prior to submitting each GIW. The third part of the application process is conducting and submitting the Housing Inventory Chart and the point-in-time counts. The Housing Inventory Chart, or HIC, is a document that captures all of the housing dedicated to homeless persons in the COC area. The point in time, or PIT, is a count of the number of homeless persons in the COC area on the night in January. Both of these activities are required by HUD and are point-bearing in the application. The next part of the application process is submitting the system performance measures. System performance measures are calculated using Homeless Management Information System data and paints a picture of the state of homelessness in the community. Submitting system performance measures is required by HUD and is point-bearing on the application. The next step in the application is project review and ranking. Every community conducts this process differently, but generally begins work in February. The rank and review process is developed by the local COC to prioritize COC-funded projects for continued funding as required by HUD. Running at the same time is the release of the NOFA and the COC Consolidated Application. The COC Consolidated Application is all within HUD's electronic system called eSNAPs. The collaborative applicant is responsible for submitting the application. The COC application is one part of the consolidated application. It contains information about the COC planning body, governance, overall performance, and the strategic planning process. HUD scores the COC application to determine the order of funding by COC nationwide. The priority listing is the second piece of the consolidated application and contains project applications completed by grantees and then placed in ranking order using the local COC rank and review process. Additionally, the priority listing includes the 2991 certification of consistency with consolidated plan. CARES is required to create a summarized list of all projects and present this to the local municipality for review and approval. Next, I would like to take a moment to review project tiering. Tiering is a result of the rank and review process and is detailed in the NOFA. The 2021 NOFA describes the COC's requirement to tier projects into two categories based on the COC's annual renewal demand, or ARD. A community's annual renewal demand is equal to the sum of the annual renewal amounts of all projects within the continuum that are eligible to apply for renewal in that fiscal year competition. The ARD is taken before any adjustments are made for rental assistance, leasing, or operating lines based on their fair market rent. Tier 1 is equal to 100% of the COC's ARD. Tier 2 equals the amount of bonus funding plus specific DV bonus allocation funding. Bonus funding is available to apply for in the amount of 5% of the COC's final pro rata need. DV bonus funding is available to apply for in the amount of 15% of the preliminary pro rata need, not to be less than $50,000. Planning projects, which are 3% of the ARD, and UFA projects, which are 3% of ARD, are not tiered. There must be a local and transparent application process. This list documents funding for each of the COCs that CARES works with, and lists the ARD, Tier 1, Tier 2, bonus, and DV bonus amounts available. This information is on the CARES website, on the NOFA page, under the Public Notice section, within the tabs for each COC. The COC application has a total of 163 points, with an additional 25 bonus points. As noted on the current slide, there are 5 criteria sections. In this presentation, we will only provide a brief overview of what HUD is reviewing within each of the criteria. You can find detailed information of each criteria, including specific point breakdowns, on pages 59 through 78 of the NOFA. HUD will award up to 96 points for COC coordination and engagement section, which is the largest amount of points available to be awarded. Points will be awarded to COCs that demonstrate coordination with other systems of care that serve homeless individuals and families, including projects that utilize funding sources other than COC program funding. Points will be awarded to COCs that ensure provision of mainstream benefits. Points will be awarded to COCs that demonstrate an inclusive and outcome-oriented community process, including an organization's structure and decision-making process for developing and implementing a COC strategy that is inclusive of representatives from both the private and public sectors, and have a fair and impartial project review and selection process. Finally, points will be awarded to COCs that have created, maintained, and built upon community-wide inventory of housing for homeless individuals and families. For example, an increased number of points are being awarded to COCs that collaborate with public housing authorities. Lastly, most notably, within this criteria section, 20 of the total 96 points are awarded to COCs who demonstrate how they've addressed COVID-19 within their geographic area. For example, how the COC addressed safety protocols for persons experiencing homelessness, how the COC coordinated with mainstream health providers to stop the spread of COVID-19, how the COC identified eligible persons experiencing homelessness for COVID-19 vaccinations, and how the COC collaborated to distribute ESG CARES Act funds. HUD is awarding 30 points for project capacity, review, and ranking to COCs that demonstrate the existence of a coordinated, inclusive, and outcome-oriented community process for the solicitation, objective review, ranking, and selection of project applications. Points will be awarded to COCs who evaluate and competitively rank projects based on how they improve system performance. HUD is awarding 23 points for system performance measures. Under this section, COCs must report their system's performance measures and demonstrate a COC system-wide performance measurement process related to reducing homelessness. Something to take note here, HUD recognizes the effects of COVID-19 on COC performance data quality, and compared to previous COC NOFOs, it reduces the points available for rating the system performance. However, HUD plans to significantly increase the points available for rating system performance in fiscal year 2022 and subsequent COC NOFOs. HUD will award up to 11 points for the section on HMIS, Homeless Management Information System, to COCs that demonstrate the existence of a functioning HMIS that facilitates the collection of information on homelessness using residential and other homeless services and stores that data in an electronic format. And finally, the point in time count. HUD will award up to 3 points to COCs that collect, use, and submit data from the 2021 PIT count. A couple of items to take note. This year's NOFA will only assess the sheltered PIT count and not the unsheltered PIT count. However, COCs will be scored on if they commit to implementing an unsheltered youth PIT count in calendar year 2022. That includes consultation and participation from youth-serving organizations and youth with lived experience. As noted earlier, there are a total of 25 bonus points. Coordination with housing and healthcare gets 10 points, and COC merger gets 15. Breaking down the points related to coordination with housing and healthcare, 5 of the 10 points are available for COCs that apply for at least one new permanent supportive housing or rapid rehousing project that expands upon housing subsidies or subsidized housing units not funded through the COC or ESG programs. And the other 5 points are available for COCs that apply for at least one new project and that utilizes healthcare resources to help individuals and families experiencing homelessness, with a written commitment from a healthcare organization valuing the assistance to be provided. There is the fiscal year 2021 COC NOFO summary webinar in a nutshell. As a reminder, additional webinars are posted on our website and cover new project opportunities, DV bonus opportunities, opportunities for renewing projects, eSNAPS refreshers on setting up a renewal project and setting up a new project. Thank you for participating in our webinar series, and please do not hesitate to contact anyone on the CARES planning team with any questions or concerns. Thank you.